1 out of 10 people I meet every day suffers from diabetes or pre-diabetic conditions. These numbers are growing very high and very fast. Hi friends, I'm Dr. Roshan Oommen, general practitioner and diabetic specialist at AshTree Clinic. Today, I am discussing a fast-growing health concern, that is diabetes. It is also known as a silent killer. Why is it a silent killer? How is it growing fast? What can be done to stop it? I will explain this to you. Before we get into it, let's take a look at some key figures about the disease. International Diabetes Federation shares that around 537 million adults are living with diabetes in 2021 globally, and this number is predicted to rise to 643 million by 2030 and 783 million by 2045. What worries the most is 1 in 2 adults with diabetes is undiagnosed. Nearly 1 million people in UAE suffer from diabetes and are expected to reach 1.3 million by 2045. Currently, 634,000 people are undiagnosed, which itself is a worrying number. Diabetes is a top growing concern in UAE, adding to healthcare and economic stress. Type 2 diabetes takes up to 90% of the diagnosed population. This is mainly because of sedentary lifestyle and bad eating habits. Even children are affected at an early age, again due to obesity coupled with physical inactivity and unhealthy diet. Diabetes is like a magnet which attracts chronic diseases like hypertension, that is high blood pressure, high cholesterol levels, which can result to irreversible damages and complications to the heart, kidneys, eyes and nerves if not noticed or treated. This makes it a silent killer. Having pre-diabetes puts you at a greater risk of developing type 2 diabetes. It can be prevented with lifestyle changes and medical advice. Diabetic care programs are proven effective to reduce this risk by 58%. How do you know you are a pre-diabetic? Notice for symptoms like frequency of urination, intense hunger or thirst, sudden weight loss, getting tired or feeling weak, skin infections, non-healing wounds, tingling and numbness, and loss of sensation in the hands or feet. Know your risk factors. Do you have a family history of diabetes? There is a high chance of you developing diabetes. Other factors include your lifestyle, the amount of exercise you get, the sugar intake, overweight, smoking habits, unhealthy and junk foods, low water consumption. What are the tests that are done to detect diabetes? A simple test using a glucometer can give your sugar counts in your blood. Other lab tests include fasting blood sugar, your after meal blood sugar, a glucose tolerance test, a HbA1c test, and your doctor will suggest additional tests according to your condition. Diabetes is a prolonged condition and it can be controlled. Managing diabetes requires a lot of dedication and lifestyle changes. Most of us fail due to this. Having a support alongside will get you back on your feet in no time. We at AshTree Clinic has created a diabetes care program for diabetic patients where we provide medical advice and support for patients throughout for a year-long program. With this program, you can manage your condition effectively and reduce the risk of getting other diseases. Get in touch with us to know more about the program. Do enroll yourself and take advantage of it. Remember, alone you can go only so far, but with support you can go a long way.